Do you know how to take your blood pressure at home correctly? I'm Dr. Frita. I'm a board certified kidney and high blood pressure specialist, and today I'm giving you a step-by-step guide. Here's the issue. Most people get their blood pressures checked at the doctor's office, but if you're anything like my patients, then by the time you get to the office, you're already stressed out by traffic and maybe a little road rage. You're annoyed by the overcrowded parking deck and the slow-moving valet. And then you're anxious about what I, the doctor, am about to tell you about your health and your whole life. This causes elevated blood pressures in the office that might not be reflective of your true blood pressure. This is why it's important to monitor your blood pressure at home. But if you're going to do it at home, you have to do it the right way. You must have the right blood pressure cuff, the right body positioning. You must understand the do's and don'ts. So that's what we're going to talk about today. I'm giving you a step-by-step guide on how to take your blood pressure at home correctly. Keep watching. Be sure to download your copy of my book. It's called Under Pressure. It's your step-by-step guide on how to control high blood pressure. This book is packed with valuable tools, guidelines, and information to help you to control high blood pressure. Click the link in the description to get your copy today. High blood pressure or hypertension is a leading cause of heart disease, strokes, and kidney disease. And so maintaining a good blood pressure is key for your health and your overall quality of life. I'm sharing some valuable health information in this video, so please be sure to like the video and to subscribe to my channel if you have not done so already. And tap that notification bell so you'll be among the first to know when I'm sharing new content. In order to get accurate blood pressure readings, you must make sure that you prepare yourself. You have the right environment, the right state of mind. You don't want to have any caffeine, any nicotine, no smoking, no exercise within 30 minutes of taking your blood pressure. That can cause a false elevation. Also, you want to make sure that you're in the proper position. You want to sit in a chair that has back support, like a dining room chair, and you want your feet to be flat on the ground and your ankles to be uncrossed. If your ankles are crossed, this could cause a falsely elevated blood pressure. You also want to have an empty bladder. Yes, you need to use the restroom before you take your blood pressure because a full bladder can falsely elevate your blood pressure. And then you want to make sure that the arm where the blood pressure cuff is being placed is at the level of the heart, okay? If the blood pressure cuff is down below the heart, that can cause a falsely elevated blood pressure. And then if the arm with the blood pressure cuff is above the heart, that can cause a falsely low blood pressure. And then you wait. You want to sit and wait for at least 5 minutes before you actually take the blood pressure. Do slow, deep breathing. You can breathe in for 4 seconds, hold it, then breathe out for 4 seconds. This causes the heart rate to slow down, the blood vessels to dilate, and it helps to clear the mind for your good blood pressure. Now, let's talk about the blood pressure cuff. It's important that you have the proper blood pressure cuff. Now, it is recommended that you use an upper arm cuff, okay? Yes, there are other cuffs that are available, the wrist cuffs, the thigh cuffs, and consult with your physician because there may be certain restrictions that you have. But it is preferred that if you can, to get yourself an upper arm cuff. The blood pressure cuff I happen to have here is of the Omron brand, but there are many, many good blood pressure cuffs. If you go to the website, validatebp.org, you'll get some of the tried and true blood pressure cuffs that have been shown to be accurate. When you're checking your blood pressure, it's important that you put that blood pressure cuff on the bare skin of your arm. So don't do it through a jacket, not even through thin material. Now, before you even purchase your blood pressure cuff, you need to make sure it's the right size, because if the blood pressure cuff is too small, it will give you falsely elevated blood pressure readings. And if the blood pressure cuff is too loose, it will give you falsely low blood pressure readings. So how do you know the cuff size? Well, they tell you, quite honestly. So the cuff that I have is for an arm that is 9 to 17 inches in circumference. So what do I mean? I mean that what you need to do, please, is take a tape measure. Take a tape measure and measure around that muscle belly, okay? Where your little muscles are. You measure that and you see what the circumference is, okay? And if your arm circumference is between 9 and 17 inches, then you would be able to use this cuff that I have. So before you even purchase the cuff, take a look and see, is it a large? Is it an extra large? For me, my arm is between 9 and 17 inches. That's what this cuff is, so I know I have the right cuff. Now, what you really need to do is read the instructions on the blood pressure cuff because it will tell you the proper positioning. For this cuff, it needs to be placed about a half an inch above the bend of the elbow. And, it varies from cuff to cuff. There are some companies that will tell you they want it to be 1 inch above the bend of the elbow. Some have a range, 0.8 to 1.2 inches. So read so that you know. Okay, so mine's placed about a half an inch above the bend of my elbow. Y'all see that? And according to my instructions, this tubing needs to be right in the center of my arm. Okay, again, the instructions are very clear. It's going to vary depending on your blood pressure cuff. But now I know I have it. It's nice and snug. I know it fits my arm. And so I'm ready to press the button and take my blood pressure. But remember, before pressing the button, you would have been sitting here for 5 minutes, legs uncrossed, proper positioning, all of those things we discussed. Okay. Hold up, is this thing not on? Oh yeah, you want to turn the blood pressure cuff on. Oh, the other thing, you have to make sure that the blood pressure, again, the arm is at the level of the heart. So you want to rest it on a table or rest it on the desktop. When you're checking your blood pressure, you want to make sure that you're quiet. There's no talking. You need a calm environment. You don't want barking dogs. You don't want children running around here screaming. You don't want the news and all this kind of stress on television. You don't want the alarm going off. You don't want to be thinking about anything. You want a calm environment to give you the most accurate blood pressure. Here's the other thing. You want to take the blood pressure more than once. So if your doctor has asked you to do a blood pressure log, for example, consult with your doctor, but it's often good if you do the blood pressure multiple times in a day, at least twice a day, okay, in the morning, in the evening or afternoon, or maybe even 3 times a day. And at each setting, take the pressure more than once, okay? Take it 2 or 3 times in the morning, preferably before you take your blood pressure meds. And then average out which blood pressure is the most accurate, okay? Do the average, and that gives you what the likely blood pressure is. Same thing in the evening. Check the blood pressure, check it again, wait some time, 5 minutes, check it again, and average it out to see what the blood pressure is. You also want to check that pulse. The reason you want to check the pulse or the heart rate is because sometimes the medications your doctor may prescribe will depend on the pulse because there are certain blood pressure medications like the beta blockers that have a side effect of slowing the heart rate down. And then there are different ones that could speed the heart rate up. So make sure you record your blood pressure numbers and the heart rate. Would you like to have a one-on-one conversation with me to discuss your blood pressure specifically or other medical concerns you may have? Would you like my undivided attention as we discuss your specific medical journey? If so, you are in luck because I offer a concierge telehealth service where you can get my direct input on your health concerns. Be sure to click the link below. It's important to have the proper blood pressure so your physician knows how to adjust your medications or your diet or your lifestyle. Be sure to watch my video on 16 ways to lower your blood pressure by diet and lifestyle modifications after you finish watching this video. Now let's talk about what the numbers that you get on your blood pressure monitor actually mean. Well, it is normal for your blood pressure to be less than 120 for that top number, systolic, and less than 80 for the diastolic number. Consult with your physician on what blood pressure is right for you. If your blood pressure is 130 over 80 or greater, you have hypertension. So that's if that top number, that systolic, is 130 or greater, or if that bottom number, the diastolic, is 80 or greater. Maintaining a good blood pressure is critical for your health, and it's doable if you manage your blood pressure at home. It's also doable if you make sure that you have healthy habits on a day-to-day basis. Be sure to download your free copy of my Healthy Habits Guide. It will lead to a better health and a better you. Check the link in my description. Now that you have these pearls of knowledge on checking your blood pressure at home, I hope you run out and get the proper blood pressure cuff. Make sure it's the right size. Get yourself the right environment when you're taking your blood pressure. Make sure you have the right body positioning. You remember all the do's and don'ts. And these things will help you to live your healthiest, happiest life. I thank you for your support. I appreciate you for watching. And I'll see you on the next video. I'm Dr. Frita.